Okay, so we discussed here about our RBC abnormalities. Okay, so for this topic, kindly refer, especially for the picture of your different morphology, especially the abnormal morphology, kindly refer to your PowerPoint for some pictures. And kindly make sure na kilala nyo ang mga abnormal RBC. So we classify here your abnormal morphology or RBC. Abnormality here is number 1. RBC abnormalities according to the following. Number 1, abnormality in the size. Abnormality in the size, we call it once your anisocytosis. Okay, our measurement here for abnormality in the size, we have here one of your blood indices. We have 3 blood indices. One is your MCV, your mean corpuscular volume, MCH, mean corpuscular hemoglobin, MCHC is your mean corpuscular hemoglobin concentration. Okay, for the abnormality in the size, ang ating baseline for the parameter here for us to check if this was normal in size or not would be your MCV. Okay, the normal MCV value here is 80 to 100 FL or your femtoliter. So based on that measurement, we could classify the RBC here as number 1, normocytic. Itong term natin, cytic is for the size. If you try to describe for the size of the RBC, that's your cytic. So normocytic is the RBC which has this MCV value between 80 to 100 FL. Kaya normocytic. So that occur here could be seen in the following. Number 1, normal RBC. Or you could also have here pathologic conditions. Still ang kanyang MCV values nasa 80 to 100 FL. So we have your acute post-hemorrhagic anemia, we have here your hemolytic anemia, then we have your hemoglobinopathies. And kanina, with our metabolic pathways, your hemoglobin M is one of your hemoglobinopathies. So consider siya as normocytic. Okay, then we have your aplastic anemia. Okay, aplastic anemia is characterized here by pancytopenia. So this is characterized here by the decreased production not only of your RBC, platelet, and WBC, that's your pancytopenia. That occurs, example for that is your Fanconi. Okay, we have here your Fanconi anemia. Fanconi anemia is a type of your pancytopenia. So this is characterized by the decreased production of the bone marrow here of your RBC, WBC, and platelets. Kaya pancytopenia, lahat ng blood cell production ay affected. Magkaiba ito sa Fanconi syndrome natin na mini-mention sa AUBF natin sa analysis of urine and other body fluids. Now we have here the microcytic. Kung sabing microcytic, so your MCV is less than 80 FL. So this one could be seen here in chronic post-hemorrhagic anemia, could also be seen in your thalassemia, could also be seen in your iron deficiency anemia. In the case of your iron deficiency anemia, so the most common cause of your iron deficiency anemia would be your gastrointestinal tract bleeding. Okay, remember here that our RBC, merong iron component ang ating RBC. So if you are losing RBC because may bleeding disorder ka, so it could lead also here to your iron loss. Okay, that's result to your iron deficiency anemia. Okay, then we have here the term RDW, so red cell distribution width. So this is a parameter that being computed by our automated instrument that would try to describe the degree of your anisocytosis. It would try to describe here the degree of the change in your RBC size. So the normal value of your RDW, we have here your 11.5 to 14.5%. This parameter could help us differentiate between your thalassemia and iron deficiency anemia. Thalassemia would have a normal RDW, whereas your iron deficiency anemia would have an increased RDW. But both of them belong to your microcytic. So, if you are, for example, may case study ka, okay, so itong basihan natin, like may mga case study tayo, so bibigyan ka ng mga values to check for the blood indices muna. For you to classify as normocytic, microcytic, or macrocytic. And for the case of your thalassemia versus your iron deficiency anemia, then titingnan mo ang kanilang red cell distribution width for them to be differentiated. So, pag normal, ang ating red cell distribution width, so that's your thalassemia. If the red cell distribution width here is mataas, tapos microcytic siya, less than 80 FL ang kanyang MCV, suspect for the presence of your iron deficiency anemia. Okay, the next we have here, malaki na size, that's your macrocytic. Okay, so this is our condition wherein the RBC would have here, okay, MCV value more than 100 FL. That could be seen here, number 1, in your megaloblastic anemia. Like what? Folic acid deficiency anemia, vitamin B12 deficiency anemia. Vitamin B12 deficiency anemia could be seen here in your pernicious anemia, in your sprue, gastrectomy, or your Diphyllobotrium latum infection, that's your fish tapeworm. That results to your megaloblastic anemia with having that sobrang laki na RBC size, that's macrocytic. Non-megaloblastic anemia naman, the following conditions also try to have your effects or try to change the size of your RBC, lalaki ang RBC natin. In the case of we have the liver disease, we have your hypothyroidism, we have your chemotherapy, and we have also here your alcoholism. Okay, so another one parameter here that would help us then to check kung megaloblastic anemia. So megaloblastic anemia could also be ito, could be diagnosed also here by number 1, the presence of your hypersegmented neutrophil. Hypersegmented neutrophil, the normal, pag sinabing hypersegmented, kung ito yung neutrophil natin, di ba, meron siyang ganyan lobes. Ang normal lobes or segmentation is nasa 2 to 5 lobes lang dapat. Kung sobrang dami ng segment niya, more than 5 lobes, then that's your hypersegmented neutrophil. And that might signify for your megaloblastic anemia. Another one, finding of your Howell-Jolly bodies could also signify your megaloblastic anemia, aside from your MCV. Okay, so these are just IBC abnormality as to the abnormality in the size or your anisocytosis. Okay, the next abnormality, we have here abnormality in the hemoglobin content. Okay, the abnormality in your hemoglobin content, you call that one as your anisochromia. Okay, for the measurement of your abnormality in your hemoglobin content, so we have here another blood index, MCHC, or you call it once your mean corpuscular hemoglobin concentration. And you could also measure that hemoglobin content here in terms of the pallor area. So pallor area, para siyang may darker area in the cytoplasm, the RBC, or pallor area. Okay, so in terms of the hemoglobin content, ang term natin dyan, so pag normal ang kanyang MCHC, that's your normochromic. Chrome is for the color. Diba? Cytic kanina, normocytic. Cytic is for the size. Ito naman sa hemoglobin content is your normochromic. So normochromic, we describe this one as MCHC concentration of between 31 to 36 grams per DL, which is the normal MCHC value. And then hemoglobin here, try to occupy 1/3 pallor area of your entire hemoglobin content. Okay, so condition related to your normochromic, so pareho lang din na kanina sa ating normocytic. Normal RBC, your pathologic like your acute post-hemorrhagic anemia, hemolytic anemia, and we have also here your hemoglobinopathies, and even your aplastic anemia. Okay, next one, we have your hypochromic. Hypochromic RBC, those are RBC wherein MCHC here is less than 31 grams per DL. Hemoglobin content occupies here 1/3 pallor area. And seen also here the same condition kanina sa ating microcytic. So, ang ating hypochromic, like for example, your chronic post-hemorrhagic anemia, your thalassemia, and iron deficiency anemia. So, ang mga condition na yon, pag nag-describe tayo ng kanilang blood picture, like thalassemia, iron deficiency anemia, so that's microcytic hypochromic. Okay, so kanina, pag normal, normocytic, normochromic. Ganon. Another one, we have here your hyperchromic. Hyperchromic, on the other hand, characterized by MCHC concentration more than 36 grams per DL. The polar area here would eventually be more than 1/3. So, sobrang ano niya, ganyan ko na RBC natin. So, medyo sobrang dark area. Okay, that's your hyperchromic. So, condition associated with your hyperchromic are also related to your kanina macrocytic. Like what? Your megaloblastic anemia. In addition for that, you could also appear to be hyperchromic. Ang hyperchromic in the case of your spherocyte would that be related to increase na is not more than 36 grams per DL, but it appears to be hyperchromic kasi sobrang dark area niya. It's because of the sphering na nangyari. It's trying to become sphere. So we have your two conditions that result here to your production of your spherocyte. The first one, hereditary spherocytosis. Another one is your autoimmune hemolytic anemia. These two here could be differentiated by the following tests. The first one, osmotic fragility test. Both of them would have here an increase in results. And they could be differentiated only by our DAT, direct anti-globulin test, or other name for that is your Coombs test. This test would try to detect your RBC na hemolytic reactions, autoimmune hemolytic anemia. So magpapositive lang sa DAT natin, direct antiglobulin test would be your autoimmune hemolytic anemia, but not your hereditary spherocytosis. So mga megaloblastic anemia natin, pag sinabi natin anong blood picture niya in terms of the size, that's your macrocytic. In terms of the hemoglobin content, that's your hyperchromic. Okay, so always remember the terms. Do not use them interchangeably. Okay, the third one, we have here abnormality in the shape. Abnormality in the shape, you call that once your poikilocytes. The poikilocyte will decrease your ESR, your erythrocyte sedimentation rate. Okay, it will decrease here the erythrocyte sedimentation rate because remember the first step in the erythrocyte sedimentation rate would be the rouleau formation or stack of coin arrangement dapat. In order for the IBC para mag-settle, diba? So that's the principle of your ESR. Pero kasi pag may mga iba-ibang shape niya, hindi agad sila mag-rouleau formation. Pag hindi agad sila mag-rouleau formation, hindi agad sila mag-settle. And therefore, IBC with abnormal na shape would decrease your ESR na result. So abnormality in the shape could be, number one, abnormality in the development in the case of your megaloblastic anemia. Abnormality in the development, that's you call once your asynchronous development is because here na hindi sabay-sabay nagmamature ang kanyang nucleus and the cytoplasm. Nagmamature ang kanyang cytoplasm pero ang kanyang nucleus hindi siya nagmamature. It's because your megaloblastic anemia are most likely defective na DNA. So, nucleic acid ang kanyang defects and therefore hindi siya nagmamature the same way ang kanyang cytoplasm. And therefore, you call that one as your abnormality in the development, asynchronous development. And the next one, we have here abnormality in your RBC membrane. First one, we have the term acanthocyte, turn cells per cell. Ito yung mga RBC natin wherein they have the spicules, okay, spiculated or may mga patusok-tusok. But the spicule here, hindi ganun ka-pointed. At the same time, the spicules here are irregularly spaced. Hindi ganun ka-regular ang kanilang spacing. Plus, unevenly distributed. Hindi pantay-pantay. Hindi siya ganun ka-sharp compared with your here sa ating echinocytes. Okay, your acanthocyte could be seen in the following. Number one, abnormality in the LS or your lecithin sphingomyelin. Another one, a beta lipoproteinemia. Third one, we have your pyruvate kinase deficiency. The next one, na RBC membrane shape, we have your echinocyte or Burr cell, sea origin, or your crenated na RBC. So this would resemble here your acanthocyte, only that this one would have, so parang ganito siya. Sorry. So ang kanyang spicules ay medyo sharp compared with your pointed compared with your acanthocyte, and at the same time, the spicules here are regularly spaced. May regular na interval. So, saan makikita ang ating echinocyte? Number 1, renal problem. So, if the patient will have renal problem, so echinocyte, or maybe seen also here if your ETA, okay, try to store ang anticoagulated blood or the ETA blood in the ref wherein nag-loss na ng ADP ang ating RBC, and that's also here with your echinocyte versus sea urchin or we have cremated. So kindly memorize all their other names ng mga cells natin. Acanthocyte, so para lang 30 cells per cell, something like that. Okay, the next abnormality here with the RBC membrane, so we have here your target cell. Other name for that is your Mexican hat or your podocyte or your leptocyte. Leptocyte is just a thin variant. So this is characterized here by central area surrounded by a clear ring of your hemoglobin, parang may target. Okay, so this is also characterized by increased surface area volume ratio. This is associated with your thalassemia or even in your hemoglobinopathies. Spherocyte, on the other hand, so characterized by the defective na spectrin. So, sobrang ganyan. Okay, hyperchromic. Spherocyte is the defective in the spectrin. Okay, so it's characterized by decreased surface area volume ratio. And this is associated with your hereditary spherocytosis. Next one, elliptocytes. So, parang ganun, elliptical. So, it's characterized by bipolar aggregation of your hemoglobin. And this is also defective na cytoskeleton. Like your actin, ganon, myosin. This is seen here in hereditary elliptocytosis. Okay, the next one, we have your mouth. Para siyang may mouth or slit-like pallor at the center of that. We call this one your stomatocyte or your mouth cells. Stomatocyte or your mouth cells. Okay, so this is characterized here by your mouth-like or the slit-like area in your, okay, at the center of your RBC. This is seen here in the following. Number 1, RH null. So RH null are those individual na walang mga RH antigen. Like for example, what do you mean by RH antigen? Like for example, if your blood type, di ba, RA positive na blood type, ang positive pertains to your RH na blood group system. So, most likely, wala siyang ganong. Ang ating RH, ito yung antigen na D, C, saka E na antigen. Pero ang tinitest lang natin pag nag-blood typing tayo, like positive, negative, ito lang siya. Routine. So, kung RH null ka, ito lahat, wala ka lahat ng mga antigen na yan, then you are called here as an RH null. And itong magiging RBC niya, so we have your stomatocyte. Another one, you could also see in your stomatocyte in the electrolyte imbalance or electrolyte abnormality. Okay, so this is characterized by increased sodium and decreased na potassium. So this is the concentration of your sodium and potassium inside the RBC. Normal kasi, madami kang potassium dapat sa loob ng ating RBC at konti ka lang na sodium sa loob ng RBC kasi ang sodium natin madami siya sa labas. Pero pag ang ratio natin bumaliktad, dumami ang concentration ng sodium sa loob ng cell natin, kumonti ang potassium, then it might also induce here the production or formation of your stomatocyte. On the next one, we have here the presence of your abnormal hemoglobin. You call this one, sir, meniscocyte, drepanocyte. So, ito yung itong ma-shape na C, S. Okay, instead of usual na biconcave, sa kanya S, C, or holy leaf. So, that's your meniscocyte, drepanocyte associated with the presence of your abnormal hemoglobin in the form of your hemoglobin S. And that's seen here in condition like your sickle cell anemia. Another one, we have here abnormality due to your trauma with your IBC. Trauma due to your physical damage, mechanical damage, or thermal damage. So we have here the IBC keratocyte. This one would have a horn-like projection. Mesocytes is your pinch cell. So para siyang pinch, gano'n. Sobrang, ayan, kinurot. Okay, this is due to the passage of the RBC in your fibrin strand or your altered blood vessels. It is also associated here with your microangiopathic hemolytic anemia. One abnormality here with the RBC membrane due to your trauma. So we have your duct ryocyte or teardrop. Duct cry, di ba? That's why it's being called here as your teardrop. So this is primarily produced here because the squeezing of your RBC is trying to pass through your splenic sinuses. Pag sinabing sinus, ito yung mabutas sa spleen natin. So medyo nahirapan silang lumabas, dumaan. So para siyang nagkaroon ng teardrop. Okay, so this is also seen in condition here like your MMM. That's your myelofibrosis with your myeloid metaplasia. Another one, RBC abnormality due to your trauma would be your pyropoikilocyte. The pyropoikilocyte characterized here by a very sensitive na RBC with your temperature. Okay, usually the RBC try to fragments if it's try to subject that one at 49 degrees Celsius. Sa kanya, kahit hindi ganun kainit pa lang, 45 degrees Celsius pa lang, nagpa-fragment na siya. So, sobrang sensitive niya. Hindi pa ganun kainit, nagpa-fragment na siya agad. Okay, that's your pyropoikilocytes. Okay, next we have here the presence of your inclusion bodies. So, ito na mga inclusion bodies natin. Okay, the first one, we have your Howell-Jolly bodies. Okay, Howell-Jolly bodies is the defective na DNA. This is your DNA fragment related to your defective na DNA synthesis. This one related to your Megaloblastic Anemia. And Howell-Jolly bodies usually mag-isa lang siya, singular. Para siyang structure within the RBC na parang bilog-bilog. Okay, so Megaloblastic Anemia, again, would have the presence of your hyper-segmented neutrophil. And at the same time, we have also here the Howell-Jolly bodies. Okay, so you can stain this DNA fragment. We have the specific stain. For your DNA, we have your Filgen. Okay, this one will give a positive result here for your DNA fragments with your Howell-Jolly bodies. Okay, the next one, we have your Cabot Ring. So this is a ring or a loop or a figure of 8 na arrangement. And this is a remnant of your mitotic spindle and associated with your severe anemia. On the next one, we have your blue granules or punctuate basophilia, also called here your basophilic stippling. And this is characterized here by the defective na RNA synthesis. That's why nag-precipitate ang ating RNA. Basically, could be seen here with your lead poisoning or even with the absence of the enzyme pyrimidine 5' nucleotidase. So this enzyme try to catabolize dapat ang RNA natin. Since wala siyang enzyme na pyrimidine 5' nucleotidase, ang RNA natin hindi siya nagkakatabolize and therefore it try to accumulate in the cytoplasm. And therefore, makikita mo siya as your pag-stain ng right stain, so that become your basophilic stippling. On the next one, we have your Heinz Bodies. Again, Heinz Bodies is basically your precipitated globin. And that one is being stained here, not your right stain. Just like our reticulocyte, this one could also be stained by our supravital stain. So we have your acetyl phenylhydrous stain plus your crystal violet. Okay, Heinz bodies is basically defective na globin, and that's because of the defective na hexose monophosphate shunt pathway or your pentose phosphate pathway. And that's because you don't have this enzyme, glucose-6-phosphate dehydrogenase, your glutathione reductase, or glutathione peroxidase. Okay, and nagkakaroon ng precipitated globin natin once you've been exposed to unoxidizing agents. Like for example, we have your PABA drugs. Because again, wala kang NADPH. It's because na wala kang enzyme na glucose-6-phosphate dehydrogenase. This is the necessary enzyme for your hexose monophosphate shunt pathway. Therefore, it will have here the Heinz bodies. Remember, ang Heinz bodies natin, makikita lang siya sa periphery ng ating RBC. Nasa side lang siya, hindi siya sa gitna. Okay, then, Heinz bodies would be abnormal here in the case of this one, defective na hexose monophosphate shunt pathway, pag may nakakita ka na more than 5 na Heinz bodies. Kung mga less than 5, normal pa yan. Okay, another inclusion, we have your sideroblast or your siderocyte. This is characterized here by your iron granules, primarily made up of your hemosiderin. So, hemosiderin is one of your storage na granules. Okay, stained here by our iron stained Prussian blue. So, this is seen here with your hereditary sideroblastic anemia. Pappenheimer bodies also your iron granules, primarily made up of your ferritin nga lang. Hemosiderin and ferritin are your storage granules. So, if it was made up your hemosiderin, that's your sideroblast. If your storage granules here, or iron granules made up of the ferritin, then that's your Pappenheimer bodies. Okay, usually Pappenheimer bodies could even be seen here even with the use of your right stain. Okay, next we have your hemoglobin age. This is precipitated na abnormal hemoglobin age, is being stained here by our brilliant crescel blue, appearing to be bluish-green na steeples. Okay, next we have your hemoglobin C crystals. Hemoglobin C crystal is your hexagonal, rod-shaped na crystals which try to protrude whenever the blunt end at hindi siya lumalabas beyond your Rbc membrane. Comparing that one with your hemoglobin C crystal, so that, or SC crystal I mean, okay, that one is your Washington Monument. It's characterized here by a finger-like projection, and the crystal here try to protrude beyond your Rbc membrane, lumalabas or lumalagpas sa Rbc membrane. Unlike with your hemoglobin CC, tama ba, CC, hindi siya nag-go beyond with our Rbc membrane. Okay, the next one, we have here the abnormality in the distribution. Like, for example, we have rouleau formation. So, sometimes you can encounter here rouleau formation or your stack of coin arrangement. And that's maybe related to increased plasma proteins associated with your multiple myeloma, Waldenstrom macroglobulinemia. This is just a pseudo rouleau formation. So, lalagyan mo siya ng NSS ang ating RBC. Pag na-wash off, so just related to this one. Pero pag hindi siya na-wash off, meaning to say this is a true agglutination. True agglutination here is related to your cold agglutinin syndrome, cold agglutinin disease, and we have your PAP, primary atypical pneumonia. And we have also here miscellaneous. We have your polychromasia, diffuse basophilia. It is seen here having blue-gray or pink-gray na cytoplasm, your right stain. If you try to stain using your supraviolet stain, new methylene blue, okay, those mga RBC natin, that pertains to your reticulocytes. Okay, then, reticulocyte or your polychromasia. Pag sabi polychromasia, iba-ibang color, nag-iiba-ibang color. And that because of your hemoglobin, diba? So, that's your... Pero pag stain mo ito, tawag mo sa kanya polychromasia if you have your right stain. Pero pag supraviolet stain ang gamit mo, it will be stained as your reticulocyte. That's actually reticulocyte pa din. Okay, then it's seen here pag meron tayong hemolytic reaction or hemorrhage, it's eventually try to increase our blood cell production and therefore increasing your reticulocyte concentration. Okay, another one, sometimes you could also encounter here the presence of your nucleated RBC in your peripheral circulation. Normally, dapat wala ka masyadong makikita ang nucleated RBC in your peripheral circulation. Because eventually, nucleated RBC, because mature RBC, wala siyang nucleus. So, nucleated RBC seen here, many of that peripheral circulation would have your necessary correction for your WBC count. Kasi like, for example, if you are nucleated RBC, sila pertains to your, meta-rubicite, diba? So, pag madaming nucleated RBC, pag machine ang magre-read ng ating WBC count, ika-classify ng machine natin ang mga nucleated RBC natin as WBC. Kasi by nature, ang RBC natin dapat walang nucleus, diba? Since this one, ang RBC mo may nucleus, akala ni machine natin, WBC siya. Therefore, you need to correct for your WBC count. Kailan ka magko-correct ng nucleated RBC? Pag bata, pag more than 10, Okay, this one is your newborn. Okay, so ganyan. For adult. Okay, normally naman, pag batang patient natin, may mga nucleated RBC siya. It's because here young pa kanyang mga blood cells. You're going to correct here for your WBC count if you have seen here more than 10 nucleated RBC in the case of your children or the newborn. For the adult, okay, pag more than 5 nucleated RBC, then you need to correct for your WBC count. It's because here, again, napagkamalan ni machine natin na WBC ang ating mga nucleated na RBC. But actually, they are still part dapat pa din ng RBC natin. Okay, we have the formula for that. Uncorrected WBC count multiplied by 100. Okay, then ilan ang nakita mo na NRBC? Ito yung count ni machine natin. Okay, times mo sa 100. Ilan ang nakita mo nucleated RBC plus 100. Okay, that become your uncorrected. Or that become your corrected na WBC count. Another one, you could also see in your peripheral circulation here with your malarial parasites. So, itong mga ring form natin. So, just go back na lang sa parasitology natin, mga Schaffner's that, mga ring form, ganon. And we have here your RBC membrane. Dapat ito yung first na diniscuss ko dito sa topic na to. But anyway, okay, our RBC membrane, normally, 50% of the RBC membrane is made up of your protein. Okay, protein here comprising your RBC membrane could be your integral protein or your peripheral protein. Integral protein includes your glycophrin A, glycophrin B, and this is responsible here for the negatively charged of our RBC membrane. The negatively charged of the RBC membrane is responsible here for allowing the RBC to push one another and try to repel one another. And therefore, in our circulation, hindi sila nag-stick to one another because of the negatively charged. And that's because of your glycophrin A, glycophrin P, which are part of your integral protein. Another protein which comprises the RBC membrane is your spectrin. So, deficiency ulit ng spectrin results to your hereditary spherocytosis. The another one, also part here, would be your cytoskeleton. Deficiency of that results to your hereditary eleptocytosis. Another component of the RBC membrane, 40% made up of your lipids in the form of your cholesterol and your phospholipids. Okay, then defective na LA or abnormality in your lecithin, sphingomyelin, which are lecithin, sphingomyelin is a type of your phospholipids. Abnormality in the LS ratio results to your acanthocyte. And lastly, the remaining 10% of the RBC membrane is made up of your carbohydrates. Okay, so again, kindly refer with our PowerPoint with the pictures of all your RBC abnormal morphology, including your inclusion bodies for you to familiarize with those mga RBC abnormalities. Okay, thank you.